after 12,000 patients and thousands of biopsies of teeth that are dead with root canals, it's undeniable that there's not one tooth with a root canal that's not infected. So not that many doctors are going to have the courage to go into biological dentistry, but there's about 1,000 dentists right now in the United States that are learning how to become biological dentists. They're getting trained, and there's a learning curve, right?
You are listening to The Dr. Haley Show, the podcast dedicated to helping you optimize your health. Each episode, there will be an interview or a message to help you discover better health. We will be featuring health radicals on the show to bring new ideas to the table, as well as doubling down on key fundamentals to support you living your best life. Your host is no other than the founder of Haley Nutrition, Dr. Michael Haley.
This is the Dr. Haley Show podcast. I'm Dr. Michael Haley, your show host, and today we are talking about biological holistic dentistry. And if you're already going to a holistic dentist, this episode will help you know how on point your dentist is. But if you aren't, we're going to help you make better decisions when it comes to the care and repair of things in your mouth. Dr. Yolanda Cintron has been a dentist for nearly 40 years and a biological dentist for nearly 30 years. She is a biological reconstructive dentist at the International Center for Dental Excellence in Fort Lauderdale, Florida. Dr. Cintron is nationally and internationally recognized as a leader in biological and holistic dentistry. She is known for integrating advanced restorative, cosmetic, and implant dentistry with a comprehensive whole body approach to oral health. Patients travel from across the United States and even around the world to seek her expertise in complex health-focused dental care. Pay special attention here, everyone that has been following me, because this is where we really tie things together. Dr. Yolanda Cintron, her practice is centered on the identification and removal of oral toxic loads and the restoration and rebuilding of not only the oral cavity, but all systems connected to the mouth. Dr. Cintron's clinical philosophy is grounded in the understanding that oral health and systemic health are inseparable, and that true healing requires addressing the body as an integrated whole. Through precision diagnostics, biocompatible materials, and evidence-based protocols, she also places strong emphasis on patient education and whole body wellness, recognizing that when one part of the body is compromised, the entire system is affected. And I can go on and on talking about her education and her extensive training and expertise, but instead, trust me, this is going to be a great episode. Dr. Cintron, thank you for joining me here today. I was watching your YouTube channel this morning, checking out a few of your videos, and you know, I shouldn't say this because people might just leave and go check out your YouTube channel right now. But it is awesome. You have so many videos there, and they're all broken down with great titles that help you answer whatever question it is, you know, from dental implants to, you know, amalgams, and everything's nice topically where you can get some real information for whatever problem people are having. That's a great YouTube channel. How long have you been doing that?
Maybe for 5 to 7 years.
So organized. I love it.
Yeah. My daughter, you know, she has a degree in marketing, and I hire her because I'm working on patients, you know. First of all, thank you, Dr. Haley. Finally, I meet you.
Finally.
I've been treating your mother-in-law forever, and she spoke very highly of you. So we love your product, your Aloe, and we adore the impact that it has in our patients. We do a lot of surgical procedures, and I send them from my office, go to Dr. Haley. because it truly aloe is so healing. It has like 50 benefits. But
Yeah.
the reason why we have been doing YouTube videos for over 7 years is because there's such a lack of knowledge. And my daughter said, "Ma, you have to like educate people because you know so much, but people out there, they don't know anything like this."
Mm.
So I hired her. I said, "Okay, I cannot do it. I need help because I'm actually doing physical work. It's hard for me to do a surgical procedure and also do the educational part." So we have been doing that together, and we're committed to, spreading the news of wellness starting in the mouth, like we are committed to spreading the gospel.
I love that too, and I know that about you. In fact, I called you earlier, and you may not know this because I got
Mhm.
the message on your phone, and that there just brought a smile to my face because the Jesus is in your greeting on your cell phone. I love it.
Yeah. In my medical history, also, we asked, what can we pray for? Because
Oh,
you know that there are many people that have such infections in the mouth that actually are spreading into the different organs, and that a lot of the patients are terminal. We have patients with cancer, with neurological conditions, and we want them to actually express where they're at with their spiritual life, because part of healing, the physical part is the easy part, right? I can clean somebody's mouth, but there is more than the physical part that makes a human being. So that's part of our intake. What can we pray for you?
I
And that's
love it.
what we do. Yeah.
Yeah, we like to help people understand that there's different aspects to health, and we can look at one thing like diet, but you can't. It's not all encompassing. There's nutrition, but there's also exercise. There's mental well-being, and we tie in the spiritual with that
Right.
because they go hand in hand. You need to get proper rest, and you look at all aspects
Mm.
of what contributes to health, and spiritual health, the most important.
Yeah, that's number one. Number one.
So on your YouTube channel, and even something you already said, you talked about the aloe vera, and people that are listening in know that I have a unique aloe vera. It's very different. And once you
Mhm.
have our aloe, you'll think you've never had aloe vera before from the other
Mhm.
products you consumed. It's
Right.
very different. And the fact that people have come here mentioning your name already tells me a lot about who you are and what your standards are. And I think that's going to be so key in understanding this conversation about biological holistic dentistry. But
Mhm.
I also saw some other names. One that I don't really know, I know of her, but there was a Dr. Claudia Marcella and be giving a testimonial. And she happens to be a local, well known functional medical
Yes.
doctor.
Yeah.
And the fact that I've seen her name on the who should I thank for referring box in my checkout site tells me something about her standards. And the fact that she's there tells me something about your standards. I also saw someone else that I know, Dr. Jeff Middleton, on your YouTube channel.
Yes.
And he's a
Uh-huh.
good friend of mine. And, a few decades ago, he had a severe health challenge that literally had him in a wheelchair, and it really forced him to learn natural health. And now he's just an awesome guy in the community, teaching people how to live good, healthy lives. So I think it's neat. It all comes together as we, know the same people, and it just tells me something about your standards in what you do. And I think that's going to be why this is going to be such an excellent conversation, even for people that are already going to biological, holistic dentists. How many are there? Because I know that I have told people they need, a holistic dentist,
Yeah.
but they're hard to find. And I also know that the people that have come here for aloe that have been sent by you, some of them are from Canada. We had people from Texas and literally from all over the world.
Yeah.
Are there that few biological dentists, or are maybe some of them not truly practicing holistic dentistry?
Yeah, well, that's a great question because biological dentistry is not recognized as a specialty by the American Dental Association, and a general dentist actually is going to mock, what we do. I personally, have been a victim of, my colleagues mocking me in Fort Lauderdale, in Florida, in other states, So when I go to a dental organization that's general dentistry, they're not that knowledgeable, and there's an actual uh, close-minded, like I came to become a biological dentist by the grace of God. I relocated from New Jersey, sold my practice. I wanted to just see the palm trees and the sun. I didn't care about 3 houses and 2 dental practices. I just wanted to have a place that out the window I could see a palm tree and the sun. That was my aspiration. And then when I started looking for a dental office, I met a biological dentist, and he was brilliant. He was an engineer. He invited me to an international meeting for oral medicine and toxicology back in 1996. So I went, and my background is in science. So everybody there was a very sophisticated scientist, toxicologist, immunologist, pharmacologist, all speaking about the danger of mercury in the environment, in the human body. And me, as a dentist, I was placing mercury without knowing that this amalgam, feeling that they taught us how to do in dental school was actually poisoning all my patients and my family. So once I came from that seminar, I was in Toronto, Canada. That meeting was an international meeting. I came back very, very, very humbled, and then asked myself, what else don't I know? I swore that I would cause no harm. And now I find out that I'm harming people. So then I went to, do I get out of this mess and start all over again, after I spent, 10, 12 years of my life becoming a dentist, or I learn what ways I can do it better. So under the wing of this doctor, I spent a year with him, and then I realized that there's biological testing, blood work that I can do on my patients to see what dental materials are compatible with their immune system. I learned about DNA biopsying of surgical sites, gums, and root canals. And after 12,000 patients and thousands of biopsies of teeth that are dead with root canals, it's undeniable that there's not one tooth with a root canal that's not infected. So it's not a popular belief. So not that many doctors are going to have the courage to go into biological dentistry. But there's about 1,000 dentists right now in the United States that are learning how to become biological dentists. They're getting trained, and there's a learning curve, right? In my journey of being a dentist, I realized, okay, so for me to do this kind of dentistry, I became a surgeon. I went to courses to train myself. How do I do a surgical extraction? What equipment I need? I have a laser, I have a piezotron. So because my colleagues were not interested in removing the teeth that were infected, because they're like, I don't see anything wrong in the x-ray. Well, what about that huge abscess and that cavitation? Oh no, send it to the specialty and let them open the jaw, scoop out the infection, leave the rotted tooth there, and put mercury, and that's called an apical. So that's one of the protocols that is practiced and is standard of care in the United States. So for me to be able to do biological dentistry and not be persecuted by the Board of Dentistry, they did not want me to speak to the patients about mercury being toxic.
Oh boy.
So they had a little conversation with me with attorneys present, that, I shall not tell patients. But then came a law, they removed the gag law. that then I can educate people properly. So, but it's been an interesting journey. And what I have done, because I want to prove that what I do is above standard of care, I document everything. I photograph every step of what I do to prove that there's decay, there's infection. We do biopsies. And also, we have a lot of consents. In the state of Florida is one of the states that a patient has the right to choose their medical care and dental care. I'm not going to be persecuted because the patient decided that they want to remove the infection out of the mouth. Well, that is within the patient's right, but it was not like that before. So a lot of advancement has occurred in benefits of the patients. We live in a great state. We're very blessed.
For sure.
In other states, it might be different. My prayer to the Lord is that more dentists would become more interested in not being right, but doing what's right for the patient. Because when we go to school, they teach us, it's just basic information. You really are going to become a dentist when you go out and you listen to the patient, you look at their medical history in a comprehensive way, you work with the medical healthcare providers that are helping that patient. And then together, as a team, we achieve great results.
Yeah. You said a few things that really perked me up a bit. For instance, one of the things you mentioned was the persecution and the things that came from your own profession, which really is a badge of honor. We're I would never compare myself to Jesus, but I would recognize the fact
Right.
that he being perfect was persecuted.
Yes.
We being flawed, how much more should we be persecuted?
Yes.
But when you're doing something and you're persecuted, it's usually because you're doing something that might be against the grain, but eventually the change comes and it becomes accepted and understood. So it's a badge of honor.
You enjoying the show thus far? One of the many health secrets that we have covered on the show is all around aloe vera, specifically drinking raw aloe vera. Our aloe vera has helped our customers effectively heal their gut, increase their intestine health, lower inflammation in the body, eliminate and/or decrease acid reflux, have glowing skin and hair, and so much more. Now, as a frequent member of our audience, you will be exposed to exclusive specials and coupon codes for the awesome products manufactured by Haley Nutrition. That's right, for simply being awesome and tuning in. You can get a mini discount to help you optimize and better your health. To see how we can help and support you on your health journey, tune into the episodes and listen for coupon codes that you can use at www.haleynutrition.com before you make your orders of raw aloe vera. Once again, it's www.haleynutrition.com. Now, back to the show.
At this point in my career, after, being a biological dentist for 28 years, and I have been a dentist for 38 years. So I did not have to do it right for 10 years. But it took a lot of humility for me to go and listen to something that, how can I deny what all these scientists are saying? And I spoke to the toxicologist and I went to him and I'm like, how can this not be mainstream media? And he said, well, the toxicology book is this thick, right? And this is the mercury toxicity. So most of it now being recognized that mercury is a neurotoxin. Who's going to deny that? Mercury is toxic in fish, is toxic in your body. The American Dental Association has recognized a whole page of all these things are connected to mercury toxicity. Well, that's a big step. And it's part of our medical intake for the patient. Say, any of this, are you feeling anxious, depressed, suicidal? Do you have autoimmune? What about your thyroid, Hashimoto, neuropathy? We have patients with severe leg restless syndrome with the mouth packed with mercury and root canals. We remove all that stuff and you see a change in their medical history. or somebody with cognitive decline. So we work with a lot of very good healthcare providers that are like, hey, I want to help this patient that they have, signs of dementia. Can you check them and see if there's any toxic loads in the mouth so we can actually do detox? Because how can I do
Yeah.
detox if they have all these infections? So,
Yeah.
there's a small percentage of dentists and a small percentage of healthcare providers are becoming more interested in treating people as a whole, not just, I'm going to see your heart, but I don't do lung, I don't do gastro. Those are really, for me, doctors that are heroes because they take a lot of slack too.
Sure. Well, I want to define a couple terms
Mm-hmm.
just to help understand, because for most people, I would imagine, they go to the dentist to either have their teeth cleaned or to fix something that hurts.
Mm-hmm.
What is reconstructive dentistry, full mouth reconstruction,
Mm-hmm.
cosmetic dentistry? And how is that different than general dentistry and holistic dentistry? Can you tell us something about those terms so we can kind of understand
Yeah.
why people would go to a dentist?
Yeah. So as a dentist, you get a general education. So the more that you know, the more you know. So I became a dentist because I wanted to be a cosmetic dentist. So when I look at a person, I see balance, I see color, I see shape, structure. But then when I became biological, I combined that with what is the person here for. I look at the structure from the base, the bone, the gums, the positioning of the teeth, where the toxic loads, and what the person needs. So every person is so unique. So, for example, I had a 19-year-old young man that they drove from very far away, 5 hours, and he was having very high blood pressure at his age, 19. And when we did a full comprehensive examination, what did we find? We found that he had four wisdom teeth that were, a wisdom tooth is like an organ, right? The head of the tooth is intended to be outside of the mouth. But if you have a tooth that's impacted or partially impacted, that is similar to having an ingrown hair. So if you have an
Right.
ingrown hair,
Good analogy.
it doesn't come out, it's going to create infection going back. So here he is with massive infection at 19, gum infection, abscess infection, pockets of 10. So when I meet a patient, if I meet you, we do 30 photographs, a CT scan, and we're going to do x-rays. We're going to check your medical history, your blood pressure, EKG, everything, past medical history for 5 years. And we're going to say, okay, this person, just by looking at the CT scan and the x-rays, I already know the medical history. Because
Right.
I see this person has a root canal number 14. Well, what a coincidence. The medical history says he has liver cancer. That's the tooth that's connected to the liver.
Wow.
That person has mercury on all the liver meridians. What a coincidence. This person is stage 4 liver cancer. So when I see a person, I'm very comprehensive. I'm going to see the whole person, spirit, where you're at, mind, what they're saying, what their goals are. And they might need nothing. They might just need a cleaning. But not the patients that come to me. The patients that come to me were mostly referred by doctors. Most of the doctors are my patients. So what happens is that they have a problem and they want to see if the root cause is related, or removing toxic on the mouth is not going to harm them. Let's put it that way. It's going to only like build that up. So I have a patient that has 8 root canals. We remove the root canals. And what are you going to do?
I have no idea. I'm on the edge of my seat waiting for the answer.
Well, nobody wants to be missing 8 teeth, but nobody wants to have 8 teeth that are infected and giving them lung disease or, brain infection. So we design a plan. I take records of their mouth, models. So I have what they came with. in a three-dimensional form, in photograph, in CT scan, in two-dimensional, and x-rays. So we go over the photos with the patients, and then they see what I see. I ask, what do you want to do about it? Well, with the young kid, it was very simple. We remove the abscesses that are connected to the wisdom. And he came yesterday, nicely healed. We went over hygiene. He's done for the day. He learned how to floss. His gums are perfect now. They don't have 10-millimeter pockets. So he's done. Really, the session yesterday was about, God, what you think, renewing your mind, and what you speak, and having purpose. So that was how I finished that relationship. And he will come every 3 months, and we're going to check him out. But somebody with 8 root canals that they need to be removed, we use a laser and a piezotomy to remove it without traumatizing the jawbone. We're going to use plasma-rich growth factor from their own blood. That's like something new now, but I have been doing it for over 20 years. And we rejuvenate the jaw bones to have a new bone. So that way the patient has the option 6 months down the line, they can do a zirconia implant. A zirconia implant is like putting a root inside the jawbone. And then they can decide, are they going to get 8 zirconia implants, or they want to do bridges, or they want to do a partial or a denture. So in the interview with the patient, we find out what their goals are.
Okay.
If they're terminal, then we get a lot of blood work either from their doctors or baselines, because we are going to do over standard of care. We're going to document what the changes in the C-reactive protein is going to be, the A1C is going to be, and you would be so shocked. So what we do is I'm constantly learning how can I work with a doctor, a healthcare provider, to not only get the toxins out of the mouth, reconstruct and regenerate, right? We have to regenerate the bone first and then improve all those values. So somebody had C-reactive protein, which is a marker of inflammation. I had a patient that came from Trinidad, and his C-reactive protein was 134. It's supposed to be 0. So he has so much inflammation, but he really was diagnosed with prostate cancer. So the prostate, the PSA, which is an indicator of inflammation of the prostate, was at 73. That's supposed to be 0.
Right.
So when men starts getting 2, 3, 4, 5, 6, it's a problem. So we had many patients, many male patients that have a higher C-reactive protein, high PSA. We remove the toxic loads on the meridians that are connected to the prostate. Bingo. Problem resolved.
This is new to me because you mentioned liver and prostate already. So is it certain teeth are connected to certain organs through meridians, and how many of the organs can be affected by your teeth?
Yeah. Well, there is 32 teeth, right? There are 32 organs, 32 buds that, when we're developing as a fetus, you develop from the feet to the head. So everything is connected. We women love pedicures because we get massage, and then actually every single organ gets stimulated. So men should get pedicures too, because what happens is that a person that massages your feet, they're actually stimulating all the different meridians, all the organs, the heart, the brain, and it's just magnificent. So acupuncturists, for example, are very, very educated about the connection between all the meridians. It's like electrical currents. It goes from the feet all the way to the brain. It goes through the teeth. So each tooth has different organs connected. So the wisdom are connected to the heart. So when I treated the young man, his EKG was erratic. His blood pressure was scary. And I said, I'm going to do what I need to do. So we went in, remove everything. And yesterday when he came back, I said, now I'm going to do a post-op comparison of the way you came. His EKG, thank God, was normal. His blood pressure was normal, and his healing was beautiful. So we, on a daily basis, if we see 2 patients or 10 patients, we are looking at the medical history, we're looking at the meridians. And then once all that is established and they're clean and they're educated and they know how to floss 5 times a day and they're cleaning their tongue and they are brushing after every meal before they go to sleep. I counted if somebody has 3 meals, if they brush when they wake up so you don't take all that bacteria into your stomach, breakfast, lunch, and dinner, and before you go to sleep, that's 5 times. And then I see patients that have advanced periodontal disease with teeth moving, bad breath, and, migraine headaches, all disappear after we stabilize, healthy gums and teeth. Then we go into what else can we do for you, right? We're going to pray for you where you're out with God. We pray before every procedure, before every surgery, because although, in my bio, I'm internationally known, I want the patient to know God.
Absolutely.
I don't care if they remember my name. I just want them to have an experience that is going to get them close to God. And we thank God for everything that we do, every outcome. We give all the glory to the Lord because it is Him who anoints our hands. It is Him who truly heals the patient. So we try to encompass all the different things from the spirit, the physical, the mind. And then I say, well, what you said is a limiting belief. God says that you are wonderfully and perfectly made. So it's changing the mindset. And it's really great, like you said, Dr. Marcelo, Dr. Middleton, Dr. Rothman. I have many doctors that are trying to practice at a higher level with the people.
Yeah. So I'm learning a lot. One thing that I heard you talk about was when you take the root canal out, there's bone that needs to be rebuilt.
Yeah,
And
the
I
bone
know,
has to be decontaminated first. Yeah,
okay,
it's a whole protocol to actually get that out, get the ligament, get infection. Because when a doctor does the root canal, they use formaldehyde, chlorine, EDTA, one of those or all of it. So what happens is those are mummifying agents that were used in the morgue when I went to dental school and we had anatomy. Formaldehyde is where they embed the dead bodies so they don't putrefy, but it's so carcinogenic. I couldn't even be in the room. It was so toxic.
I do remember that being in that room, and I forget what it was. We used to put on our lip to help us smell what was on our lip instead of what was in the room,
Right.
which was the formaldehyde. So we were just covering up the toxic fumes that we were inhaling. But
Yeah, but it's carcinogenic. And that's
yeah,
what
sure.
root canals are embedded with.
Yeah.
So that formaldehyde goes to the bone. So then once you get the tooth out, you have to rejuvenate that bone. You got to take part of the bone out. So that way you remove the bone that is putrefied and is mummified.
Yeah.
And then you get blood flow and then you put the plasma. And then,
Which other doctors, instead of using the plasma, I think they're using cadaver bone, correct?
yeah, we have 5 different options for patients because we want to give the patients the opportunity to choose what they think is best for them. So some patients, we do plasma and the factors of growth of the plasma. And then you have factor 1, 2, and 3. And those are going to become the bone. Some patients have very advanced infections and we might use a type of bone that's called calcium biphosphate. And the brand is Atma bone. So that is fantastic because that was used for people with tuberculosis. Back in the day, people would get tuberculosis and then the bones would kind of rot and kind of disintegrate. So we use that product if the patient decides that they want to use that product to build up their jawbone. It depends how big is the hole, what kind of walls do you have. There's cow bone, there's human cadaver bone, there's pig bone. We try to, to stay away from things like pig bone and cow bone.
Try to
So
keep it kosher.
yeah. We try to do that. But there's doctors that use it. That's the protocol that they have. So we try to develop protocols that are more biocompatibles with the
Mhm.
patient. But ultimately, we tell them the advantage and disadvantage of all the different options, and then they have to make a decision.
Okay.
Because
And then
yeah,
are you eventually recommending when they put the rod in there and the tooth on top of it, or no?
well, there's two kinds of implants. So I started putting titanium implants in 2000. That was the only option. I put titanium implants on my mom, on my
And
ex-husband.
that the titanium refers just to the post, correct?
Yeah, the titanium. Now, the latest information that is available to us, and I've been doing zirconia implants for maybe over 15 years since they came out. I was one of the first dentists in the Northeast region of the United States to start putting ceramic implants. And I would consult my surgeons my local surgeons. Hey, please, Doctor so and so, can you help me with this situation? I want my patient to get ceramic implants because a zirconia implant is only 0.04% zirconia versus titanium is 100% metal. Because what's the concern with metal? Now we have Wi-Fi.
Hmm.
Wi-Fi, metal is a conductor. So, moving away from heavy metals, mercury, aluminum, all crowns have
Hmm.
aluminum, all fillings have mercury. And then what's the next thing? So I have placed many titanium implants. They have researched that they're finding titanium in other parts of the body. I don't know what system did they use. We always use the highest quality of dental materials because we know that that matters. If the dentist is give you a deal with a titanium implant and it's from China, I'm sure that's going to corrode. You know,
Yeah, yeah,
so
yeah. I understand.
I have placed titanium. My first patient that I did titanium visited me recently. I saw him 25 years ago, and he came. He had everything in perfect condition, and then one crown came loose, and they wanted to do some kind of treatment, and I couldn't believe it. It's like, oh my God, 25 years have gone by. So he had all his titanium implants. They look perfect, like I did them yesterday. And then one of the crowns came loose, and then the gum has overgrown. So I used my laser, remove the excess of the gum, clean, sterilize the crown, and I said, see you in 25 years.
All right.
So, but we prefer to do ceramic. Ceramic is more expensive than titanium, and we're moving away from titanium. Most probably the last 3 years, I've done very few
What's the
because,
strength of the ceramic compared to obviously titanium is very, very strong. Are there any issues with people that really are clinchers or
yeah,
grind or anything like that?
yeah, that's a very good question. So, if you're a clencher and you have Wi-Fi in your house and you put metal in your mouth, I think that's going to make you even more neurologically sensitive than zirconia. The advantage of zirconia over titanium is cosmetic, is less electrical current because it's only 0.04 versus 100%.
Hmm.
And then the disadvantage is that you have to place a bone, wait for the bone, at least me. I'm very conservative. I like success. So I wait 6 months for the bone to be super healthy and super strong. And then I place the ceramic implant. And our success rate with the ceramic implant is like 99%. We have had a few cases where a patient had cancer. He wanted implants. I said, you're not a good candidate for implants. Why don't we focus on getting you healthy? But he's like, no, 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 no. So he actually had one titanium and one ceramic as a test. He's like, use me as a guinea pig. And then he actually lost the titanium. So what happens is that you never know. If you're pretty experienced in implants, like I have 25 years of experience, that's a long, long time. So what happens is you choose case selection. If somebody's a clencher and obviously they lost the back teeth because they cracked them, now they need implant on the back. So what happens is that the implant cannot take the first force of mastication. It cannot take the brunt of the doorknob because then they are going to maybe damage the implant. Right now, I have many patients with back implant ceramic. So far, so good. We had an 87-year-old male that he wanted all his root canals to be removed and he wanted all ceramic. And we did 7 zirconia implants, and one of the implants didn't take because he did not follow post-op instructions. So he liked to chew on the right side, and then he chewed while that was healing on the implant. So I learned from that, put a temporary bridge, put a stent, because they're not going to listen to me. So they're going to continue to eat and do whatever. So, and he wanted the implant, and he made me do it again. So eventually worked, but I had to really emphasize, I need your help. You just are. He likes sweet. He says, I'm 87. I eat whatever I want. You give me too many restrictions. But usually when you do surgical procedures, I like the patient to be on aloe vera, on moringa, on a green diet with protein, collagen, and soups. At least 7 days, if not more. It depends how extensive the surgery is.
Moringa, we haven't talked about that. I used to have my moringa tree in front of my old home. I don't have one anymore. But we used to just go out there and strip the leaves off and throw them in our salads.
It's the best.
Yeah, amazing. Yeah. As a thank you for tuning into the Dr. Haley Show podcast, I have a special coupon code that can be used throughout the month of January 2026. Get $10 off your purchase of $100 or more at HaleyNutrition.com. The coupon code is 2026 Health. That's 2026 HEALTH. And as usual, you can even use this coupon with on sale and already discounted bundled items. Enjoy the rest of the show. Is there anything that, for a healthy person, doesn't have cancer or some condition that's going to get in the way of them getting the care they need, is there any dental problems that just can't be fixed?
Well, a lot of people are healthy. And then what I have seen in the past, I would see 100 people, maybe 1,000 people, and one person was clenching or grinding. Now, 100% of the people are clenching and grinding, which is like, this is bad. I saw a young 21-year-old female yesterday, beautiful teeth, and she had grinded her teeth to the degree that the eye teeth are called canines, right? The eye teeth are supposed to be longer than the others. She shaved them off so much that now all the teeth are grinding at the same time. Mm-hmm. So in her case, besides her cleaning and flossing, she must wear a mouth guard. Mm-hmm. And we have a new mouth guard that is made out of nylon, that people, it's going to be really hard for them to break that. And they're not going to be eating plastic. So it's called Panthera. It's phenomenal. And it's a learning curve. People that like to clench and grind, they don't want to have a mouth guard. Right. They want to break their own teeth. They don't want to have something that's going to interfere. So
is that during the daytime too, or just at night?
Some people, it depends. I had my cousin say, I don't grind. And I'm looking at all the fractures on his teeth. I don't do any of that. I'm like, you're my cousin. Why would I make this up? And I said, okay, tell your subconscious mind to wake you up or show you when is it that you're doing it. And he calls me, I-95. I'm clenching when I'm driving. I said, you see, at least now you know that you're doing it, and now you can have a mouth guard in the car, and you know that's stressing you out, put it in the mouth and drive. So you break that because breaking your teeth is very expensive.
Well, one thing I would like to do, because we're going to wind down here, we just have a few minutes left. I'm wondering if we can kind of rapid fire some common conditions and just maybe, give a do and don't kind of thing for each of these things that someone might have an issue with.
Okay.
We've already talked about it. Cavities and fillings. Do, don't. What do you do? What don't you do?
Well, if you have a cavity, try to get a material that's compatible with your immune system. Try not to get mercury fillings, amalgams. That's what the insurance pays, but that's not what's good for you because it's neurotoxin. And then try to not get white plastic fillings if they're too big, because many people, they have an increase of estrogen when they get plastics. So the plastics, they last between 5 and 8 years. And then if it's a small little plastic, it's not going to kill you. But if you're a woman with breast cancer, you don't want any plastics in your mouth because that's going to actually increase the estrogen in your body, possibly. And then, floss. The best dentist is no dentist. Floss 5 times a day. The best prevention is flossing, brushing, clean your tongue. And seeing a hygienist, I put my patients every 2 months to 3 months. That's 6 months, 1 year. That's not for people that are really mindful of being.
I agree.
Yeah.
Yeah, I could never understand what's this, twice a year stuff. That's a lot of time.
Yeah.
What about straightening teeth? Metal braces, Invisalign. What's the do? What's the don't?
I'm not, crazy about Invisalign because Invisalign only moves the head of the tooth when you have the need of braces, because some people need braces. Most dentists are moving towards the Invisalign trend because it's easy. It's a computer. You give it to the patient. It's less work for them in the office. But the most beautiful results and more long-lasting results is when the teeth are moved from the root up, not just the teeth, the shape. It'll take forever to move a canine with the Invisalign. So also, if you're grinding and you have Invisalign, you're eating all that plastic. Some people have reactions to the Invisalign trays.
Okay, so that's a different kind of plastic compared to what you had mentioned as far as the mouth guard.
Yeah, the new mouth guards that we're doing are made out of nylon.
And Invisalign doesn't do that.
No, it's plastic. It's a different kind of plastic. So It depends where you're at, how healthy you are. What do you want to add toxins to your body? We evaluate the whole picture. If you're 20, you're healthy, and you have a crooked tooth, and you're a model, you're not going to get brackets because, you're doing photo shoots, and Invisalign is going to have to work. So you have to work with the patient and lifestyle.
Yeah.
Mm-hmm.
Cracked teeth and crowns.
A lot of people clench the teeth and fracture the teeth. So if you have a lot of fractures because you're clenching, you might benefit from a veneer. As simple as that. It's like a contact lens on top of the tooth, and it's going to make that tooth 80% stronger. As people get older, what happens is that they're losing bone from clenching, and then a tooth that was this long now is like this long, and then they have no bone surrounding it. So a veneer would not work. You would have to do full coverage to actually add, material to make that tooth stronger. So each case and each tooth is very custom made. Like we are not like one fits for all, and the patients are involved in the process because we take photos and they see the problem. These are the fractures. What do you want to do with it? These are your options. And then a lot of people, when they clench, they lose the bone and the gum goes down. So we can actually raise the gums and that cover the teeth again. So that's called gum grafting. We have a surgeon that's working with us that he's adding bone to areas that We never saw the bone was growing at like that. So we're learning a lot with him. He's bringing new techniques that are really cutting edge, to our practice. We love him. He's fantastic.
Great. And the do's and don'ts when your dentist tells you you need a root canal.
Well, that's an option in the United States. That's a legal option, and we give that option to our patients. But because we don't believe that's the best, healthier for them, we refer them to an endodontist. There's many endodontists, everywhere that are willing to do a root canal. In our practice, the patients that come are seeking for me to remove the root canals. So in United States, you have to follow protocols of what's legal and what's available versus it's like the vaccines, right?
And that's removing the root canal, and is that replacing it with a implant?
It could be. It could be a bridge. Say the person has a root canal here and two teeth with mercury here that are destroyed. We can remove that bad one, get the mercury out, and connect them and do a bridge. Bridges have been around for 100 years. So, we do bridges as well. There's different kinds of bridges. There's Maryland bridges. There's full coverage bridges. And trying to stay away from heavy metals, they all crowns. And I even put gold crowns with aluminum porcelain. Aluminum also is connected to cognitive decline. So, do not use deodorant with aluminum. Try not to cook on pans with aluminum, and try to replace your aluminum crowns with something like zirconia, which is more biocompatible.
I see. Now, when I go to the dentist, if I need work done, I hate dental pain. To me, it's the worst kind of pain.
Mhm.
Are there do's and don'ts when it comes to getting numb?
Yeah. Well, you don't want to drink coffee before getting numb, right? And in our practice, we practice sedation dentistry. So we have the opportunity to give somebody either intravenous sedation or oral. That works 99% of the time. We do a nice cocktail. So that way the person is relaxed. They might not even remember the experience. If they can afford to be like loopy for 24 hours, we do that. And then preparation of the nervous system. We have Nucalm, we have oxygen, we have red light, we have Beamer. So we try to get that patient, even with natural herbs, to get them relaxed. We give them L-theanine, turmeric. So we try to get your body prepared before receiving treatment of what is the body going to react to something new is going to have an inflammatory response. So we're going to give you anti-inflammatories like arnica, turmeric, L-theanine for, chilling you out, and Nucalm. So we prepare the patient physically before we touch them. So that way they have a good experience.
That's great. And those are things that I would have never thought I would hear coming from a dentist.
Yeah.
Turmeric, arnica.
Yeah, we have all that colloidal silver. We do a lot of things that work really well to detoxify the sites. We rinse the patient with acid water, which is very effective to remove mercury tattoos. We use ozone, but we use ozone very cautiously because people come to me that they went to a biological dentist and the biological dentist injected ozone into an abscess without removing the abscess, and the infection went into the brain or into the heart. So ozone is like the new trend. Everybody, oh yeah, we do ozone. Well, you better know what you're doing when you do ozone, because ozone, you must remove all the infection before you push ozone into somebody's body. Because what happens is that ozone is going to push the infection into the brain, and we see it all the time. And they're like, yeah, I went to, and then they're strolling and they feel like they have a cap. The brain is just, you have to do your homework before you let anybody, and that applies to any profession. There's people that practice at a level of excellence and they're always wanting to do unto others as unto the Lord. And there's people that just want to get things done fast. It happens in construction. It happens in any profession. You have to feel the heart of the person because they have to be in it with you. You want somebody that wants to have a relationship with you, that wants to get to know you, and then analyze what your body is able to handle. So that's part of what we do.
All right.
Yeah.
A lot of times people are so committed to their dentist, or it's kind of like going to your chiropractor. You never want to switch because you love your chiropractor and you love your dentist.
Mm-hmm.
What are some things that you've heard from new patients that were, for the longest time, unwilling to change?
Well, like you said, most people appreciate relationships. So they have been going to the same dentist for 20 years, 25 years, and that's okay. But it gets to a moment that if that's not serving you, you can get a second opinion. But people feel like they're betraying the person that put the mercury or put the root canal. They did the best they could with what they knew.
Mhm.
So something that I would never ever speak against another professional because I didn't know what I didn't know when I didn't know it. And by the grace of God, now I know a little bit more. But I always humbly say, Lord, what else I don't know? Please don't let me harm a person because what else are we going to find out? So that's why I'm so prevention oriented because I have gone to Africa to practice in a dental clinic in Nigeria. And this is what I see. The old people don't have cavities.
Hmm.
They have teeth that are worn out from age
Wow.
and they have maybe gum infection because they don't have anybody clean their gums. But all the young people have abscesses and cavities because the diet changed.
Sure.
The sugar and it ruined their entire life because the ancestors, all of them, people in their 80s and 90s and 70s, they eat root vegetables, no
Yeah.
cavities. But our
Yeah.
diet is damaging our teeth. So that would be another, indication for me to say, what about if we change our diet? Reduce carbs and no processed food, no wheat, no bread.
Now, for someone that's thinking about changing and maybe they're on the other side of the country, do you have consultations, phone consultations available? How does that work?
Yeah. So many patients, what they do, like say I have a patient in Hawaii and she has these abscesses and she wants a second opinion. So she sent me the CT scan and the x-ray and we do a Zoom meeting
Mm.
and then they feel the medical history so we know what we're dealing with and we have a conversation. And you would be surprised. I had literally people that get on a plane and come. I just treated a lady that they wanted to do root canals on two teeth that they were not even salvageable. And I told her, please go to the first surgeon you find and have the surgeon remove those teeth are eating the jawbone into your brain. And she said they don't want to do it. They want to do root canals. I said, it's not even salvageable. You have no bone left.
Hmm.
So she got on a plane with the abscess. I said, don't get on a plane. That's going to blow up. So she got on a plane and she let us treat her. And we got the infection out and, help her out. And it's just one of those things that, we have many people coming from
Yeah.
Germany and England, Australia, Hawaii, France. We have people from Spain, Portugal, South America. And every day in my practice, we have people from all over.
What should I have asked you in this interview? One thing we didn't talk about was, the dangers of removing mercury improperly.
Yeah.
But what else should I have asked you that's important for someone to understand about biological holistic dentistry?
Well, I think that the more educated you are, the better equipped you're going to be able to make better decisions. There's a documentary that's called Root Cause, and it was removed from Netflix, but you can find it in Tubi app. It's a free app. It's TUBI, and you can watch that documentary. It's got about over 30 doctors, not dentists necessarily. They are all over the world, and they're doctors practicing at a high level. They will not treat a patient that has root canals, mercury, or cavitations because they know that they cannot achieve the level of care that the patient is looking to be released. They say if the person has these toxins in the mouth, there's no way we can like have their immune system operate properly because your immune system is so busy with this dental infection. So I would urge everybody watching to watch that documentary because you can make better decisions. Also, we have a lot of YouTube videos, like you said, in different topics. We try to make it simple, but do not remove something out of your mouth without having an expert with experience. They can show you their photos, interview people, and see if there's a match. You have to be compatible with the person that is going to be touching you. You know, a person is going to be in your space, is very close, very intimate. And then write down the questions. What is it that you're concerned? Once you have a consult, you can read what they're recommending and then go back on a second visit and then revisit, you know, what are the other options and more questions. There's no rush. Things didn't happen overnight, right? If somebody developed cancer, you know, it did not happen like yesterday. It took maybe 10, 15 years. So finding out what the options, because if somebody gets radiation, for example, then they cannot get extractions because the bone will not heal. If somebody is put on a medication that blocks the osteoclast, which is a type of cell that is going to help you eat the bone, then you cannot get a surgery because most probably your jawbone is not going to heal. So it's better to remove and clean your mouth before you get any kind of treatment because maybe you cannot go and reverse it. Oh, yeah, get all that out, but now it's too late because now your body's not going to heal. So the step and the order of things, and work with people that know a lot, that have a lot of experience, because it really makes a difference. You know, we redo a lot of work, and we're getting a lot of patients from health coaches that are trying to get the patients to get the mercury out and get the root canals out, because the word is out. All these influencers are flying in, they're getting the work out. They're like, I didn't know that this is giving me that. And it's really cool because some of them are wanting to do podcasts to educate the others, and they're being persecuted. They're like, oh my God, I got so much hate mail because I said the root canal was doing this. I'm like, yep.
Yeah, that's what you get for doing the right thing.
That's right.
Well, this has been very informative. I'll be a little transparent and tell you one of the things that I learned. And some of this I learned on my own, but now I'm going to connect some dots. Of course, I'm older and I've got dental problems, and I've had a crown that came off. And just a couple days ago, which I know that means there's probably underlying infection based on some of the things you said. And this is what actually blew me away, because I thought I had all my mercury removed. No, there's still some under the crown.
Yeah.
I wonder how many people have that. And now I know that that could be affecting a meridian, possibly affecting one of my organs. So I would imagine for everyone listening to this, they were able to make some connections based on the things we talked about and what might be happening in their own mouths. So definitely very, very informative. And I want to thank you for taking so much time. I'm going to make sure also in the show notes, wherever your people are getting this podcast, there will be a link to your YouTube channel, your website, and even the documentary that you had mentioned, Root Cause. Will make it nice and easy so people can just click a link and watch that and see your videos and more. Dr. Cintron, thank you so much. This has been great.
Thank you so much. And it was finally a pleasure to meet you.
Long time in the making, finally. Thank you.
Thank you. God bless you.
And you.
I hope you enjoyed that episode today on The Dr. Haley Show. Make sure to hit subscribe on whichever platform you are listening to this. If this episode made you think of someone, go ahead, take a screenshot, and share this exact episode with them. You can catch the show notes for this episode on www.drhaley.com. If you want to geek out with Dr. Michael Haley on other radical health topics, be sure to check out his YouTube channel, where he posts exclusive video content. All the details are at www.drhaley.com, and we can't wait to hang out with you on the next episode.